Hospitals really play a unique role in this conversation around affordability. We are the safety net for the entire healthcare system. It means that we play a special role in the provision of care. How do we innovate in how we think about our healthcare workforce? What does that mean? That means that while we will need those traditional roles, doctors, nurses, and others, we know that care is going to be shifting from the hospital setting to the outpatient setting and to home. That holds tremendous promise. Providing care in the home means that we can provide care not only in a place that patients want it, but in a way that's probably less costly. But we're going to need a whole new fleet of healthcare professionals. They may look more like community health workers, people who are out in the community, checking on our seniors, going into their homes, helping them with things beyond just their clinical needs. We need to be very mindful as we're thinking about what could be dramatic changes in the healthcare system in California to make certain that we don't undermine access to care. We already have challenges in some of our rural communities, some very remote communities in the state of California. We have healthcare deserts. Healthcare deserts in our inner cities, healthcare deserts in our rural parts of the state. It's going to be very important that we understand that we need to preserve some basic access to care in those communities. We're already seeing a bleeding of services out of hospitals in rural communities. In many rural communities today, we don't even have obstetricians. There is no maternity care available, meaning that people have to drive many, many miles to deliver their babies. If we think about hospital emergency departments like fire stations, right? They need to be there 24/7. We can play an important role to really try to understand and assess what the other service offerings might be in a community.